What causes PCOS? Like, what is the main reasons for a woman to go through PCOS?
That's a very good question, and I think all the PCOS women need to actually know what is happening in the body. Right?
Absolutely.
We need to know what
Yes.
is happening. So the basic problem is, it's quite simple. It's just an abnormality in the level of certain hormones in the female body. Okay. So when we go into a bit more detail, you have a couple of hormones which are released from your brain. There's an area called a pituitary gland.
Yes.
Okay, in the brain, not in your ovaries or reproductive system. So it's called LH and FSH.
Okay.
Don't try to remember those names. It's okay. It's fine. So these are the basic hormones which will control the reproductive system of the female and male as well, actually. So what happens is that there's a particular level which is required for the optimal functioning of the ovaries. To make the eggs. What is the function? It's just to make eggs.
Yeah.
So when LH and FSH gets abnormal, I mean the levels of LH and abnormal and the ratio is different, it doesn't work on the ovary very well. So if the eggs are being formed, we call them follicles, it will grow up to a small limit, and once the level is abnormal, it doesn't grow further. So what happens is that these eggs, which are supposed to grow slowly and open up during ovulation, and then that happens, fertilization, all these things happen. So if it doesn't grow fully, it grows halfway around, they become a cyst.
Oh,
that explains everything, right?
Okay.
So you have couple of eggs every single cycle, like 4 or 5, reaching halfway and stopping. So you don't have ovulation. So if you don't have ovulation, you don't get regular periods.
Yes.
Okay? Makes sense, right?
Yeah.
So you have a collection of eggs from every single cycle
That have not ovulated.
So when you talk about many years, there's a big collection. So you might have 10, 20, 30 or even 50
Wow.
half developed eggs in an ovary, and that is polycystic ovary.
Oh, that explains multiple, okay.
That explains
That
everything.
explains most of it, the polycyst, the multiple cysts.
Multiple cysts. Then nothing but half developed eggs.